What if I told you that you could use your own body, your own blood to help grow your hair? Sound too good to be true? It's actually fact. This is known as PRP injections, and they have been used for decades to help stimulate hair growth. While it sounds kind of science fiction, it actually is real, and there's good data and science behind it. I'm Dr. Mary Alice Mina. Welcome to my channel, The Skin Real, where I give real people real information about their skin health so that they can make informed decisions. Sound good? Let's get into it. This is my weekly recap episode where I give you my key takeaways from my most recent podcast interview. This week, I had the pleasure of sitting down with Dr. Ketterpal, who literally wrote the book on how to perform PRP injections for clinicians. And she has performed thousands of these treatments. So she's a huge wealth of knowledge. If you want to hear the full episode, be sure to stick around to the end of this short episode where I will link it. Okay, so let's break down PRP. You've probably heard of it. If not PRP, maybe you've heard about the vampire facial. And this is a real thing. It's not just gimmick or hype, and there is real science behind it. But let's break it down and talk about how it works. So PRP stands for platelet-rich plasma. We take someone's blood, we draw their blood, we put it in what's called a centrifuge, where we spin it around to help separate out the different components of blood. And then we take the plasma, which is chock full of platelets, we draw that up and we inject it back into you, typically in the scalp. But sometimes it will be used to apply to the skin directly after having things like microneedling or injected directly into the skin, like under the eyes. Now, why would we want all this plasma full of platelets? Like, what is the point of that? So platelets, I used to think they just helped clot blood. But they actually do so much more. And platelets are chock full of these things called growth factors and exosomes, which are all the rage now. And they are key components in wound healing and tissue regeneration. And studies now show that they can help stimulate hair growth. Now, the studies have mostly been done in people with androgenetic alopecia, which is basically male or female pattern baldness. However, it has been used in other types of hair loss. But I will say it doesn't work the best in things like inflammatory causes of hair loss or scarring causes of hair loss. The best candidates for PRP are people who have androgenetic or female or male pattern balding, and then someone who's within 5 to 7 years of their hair loss beginning. It's much, much harder to treat hair loss when it's been decades since it started. PRP can be great for people who are also noticing hair shedding, not just hair thinning, which can be caused by different things. And then it's also best for someone who's willing to commit to coming in on a fairly regular basis, and then for maintenance therapy. Just like with most things in life, it's not just a one-time cure and then you never have to do it again, right? Exercise, you have to do it every day. Strengthening our mind and our thinking capabilities, right? Like these are just things we do once and we forget about. So there is a little bit of maintenance involved. And PRP also works best in conjunction with other treatment modalities. Hair loss is not a one size fits all. It's not a take this supplement, take this pill, and all your problems are going to be solved. A lot of times we have to do these things in concert with other treatment options. But I do think PRP is a great option for someone who's noticing hair thinning and they're committed to keeping and maintaining as much hair as they have and minimizing how much they're losing. If you're totally bald, I think your results will be disappointing. Typically, we'll do a course of PRP treatment. So you will come in about once a month to have your blood drawn and to have the treatment. And then after about 3 months, then we go into the maintenance phase where you just need a treatment once every 6 to 12 months after that, especially if your hair loss seems to be stable and you're happy with the results. You may have heard me in the beginning talk about injections. So PRP is something where there are needles involved. It does require getting your blood drawn, which not everyone loves. I don't love it myself either, but it's pretty quick and painless. And then the injections, while you will feel, especially at the beginning, I do mix mine with lidocaine. And so I will start in one area. And then by the time I'm moving to the rest of the scalp, it's already numb from the lidocaine. So the first few pokes can be a little bit spicy, I'm not going to lie, but there are tricks we can use, ice, things like that. But it does involve some needles, just a heads up for people who maybe aren't into that. Now, some of the criticism PRP gets is that our platelet levels vary and it's hard to standardize it, right? Because my platelets one day are this, and then a couple days later, they could be something totally different. So there is some variability with platelets, but here's some things you can do to minimize that and really maximize your results. This is really going to help with your blood volume. It's going to help the person who's doing the needle stick. So hydration is key. Don't come to your appointment right after you've just done hot yoga and you're super dehydrated. Number 2 is medications. If you are on medication that inhibits platelets, things like aspirin, if it's safe to stop, then that can be helpful as well. Although it's not a hard and fast rule that you can't have it. If you're on these medications, it just may not be as effective because, again, you're on medication that inhibits platelets. The sooner you notice hair loss, the better your results will be, but also factor in diet and lifestyle. If you are someone who has been on a GLP-1 agonist, experiencing a ton of weight loss, your hair loss may be exacerbated, and you may want to wait until you're at a stable weight that you can maintain before undergoing these treatments. You also want to make sure to look at your diet. Are you getting enough protein? Are you getting enough calories? Are you making sure you have a balanced diet? You're not just eating one type of macro to the detriment of others. That can all affect your hair growth as well. Like I said earlier, PRP works best in conjunction with other treatments. So be making sure your diet is optimized. You may want to be on a hair supplement that can be helpful. Dr. Ketterpal talked about using a medicated shampoo. That's not something I've used before, but I'm definitely going to give it a try. Those medicated shampoos are things like anti-dandruff shampoos, Neutrogena T-Cell, things like that that can help decrease inflammation of the scalp because we know when the scalp is healthy, it will help optimize hair growth. I'm a big fan of topicals, whether you are doing topical minoxidil or a compounded version of that, or even topical exosomes. I think these can be great products to help stimulate hair growth. And then if you want something really cost effective, oral minoxidil is a great option. It's very affordable. I think each pill costs pennies. My whole prescription typically is under $20 for the whole month or more. And so I sort of justify getting PRP by taking oral minoxidil, and I feel like they balance each other out. But oral minoxidil is a great option for people. It's really low dose, can be really well tolerated in a lot of people, and can also just help maximize your results from PRP. So I am a big fan of PRP. I do love it. There is good data behind it, but you do need to do your due diligence when you are getting PRP performed because it does involve blood products. And there have actually been reports of people being infected with HIV when they went to a med spa where the PRP of an HIV positive patient was actually injected into other people and they actually developed HIV. So it's super important you are going to a reputable place. You do not want to go to somewhere that's offering you the lowest price possible. You want to make sure that they are not reusing the blood processing kits, that the facility looks clean, hygienic. You don't see unlabeled specimens and uncapped needles or things just lying around unlabeled. You want to make sure it looks like your doctor's office. If you're not getting it done at your dermatologist, just make sure that the facility looks as clean as a medical office space because again, these are blood products and you don't want someone else's blood being injected into your scalp. So make sure you know who's performing the procedure, make sure you know about the qualifications, and make sure they're using proper sterilization and hygiene to keep you safe. While PRP does work for hair loss, unfortunately, it's not covered by insurance typically. So this is an out-of-pocket cost, which may be prohibitive for some people. So final thoughts on PRP. It is definitely a great option if you are noticing hair shedding or hair thinning, especially the earlier on you're noticing it. You can really help save as much of that hair as possible. It works best within the first probably 5 to 7 years of the hair loss beginning. It works best when you pair it with other modalities like supplements, oral medication, or topicals on the scalp. And you do need to be consistent with it. It's not a one-time treatment. You really need those 3 and then a maintenance once a year. But I do find people who are experiencing hair loss are motivated and they want to see the benefit. Ask me how I know, right? I've done it myself. I definitely can attest to it. I've also injected my eyebrows. I found that that was helpful as well. But hair loss is multifactorial. It takes a village to get to the root of it. But I do find PRP is a great option for people who are motivated with their hair loss. If you want to hear the full episode, be sure to check it out here, and I will see you next week.